The Wolf administration is committed to working to stop the opioid crisis and its devastating effects on our families, our loved ones, and our communities. The opioid disaster declaration allows the administration to take unprecedented immediate action to work to reverse the effects of this crisis. In his declaration, the governor directed state agencies to focus on 13 initiatives that are the culmination of a collaboration between all state agencies to enhance coordination and data collection, to bolster state and local response, to improve tools for families, first responders, and others to save lives, and to speed up and expand access to treatment. To enhance coordination and data collection, the declaration created the Opioid Operational Command Center. The command center has been operational here at PIMA for approximately 45 days. Together, we're developing tools to collect data that will bolster the state's response to this epidemic. One of the initiatives set out by Governor Wolf was the development of guidance for healthcare providers and hospitals to report neonatal abstinence syndrome. The Department of Health has received 113 reports of cases of neonatal abstinence syndrome that have occurred between January 10th and February 22nd. We are continuing to work to have more facilities reporting cases of babies born with symptoms of opioid withdrawal to the department in order to help us determine where resources are needed the most. To improve tools for families, first responders, and others to save lives, the disaster declaration allowed Dr. Levine, in her role as Physician General, to expand the April 2015 naloxone standing order. Emergency medical services personnel can now leave naloxone behind in the case where a patient refuses transportation to the hospital. Through the command center, the Department of Health and the Pennsylvania Commission on Crime and Delinquency have provided EMS departments with information on this program and how they can obtain naloxone for free. The Naloxone Leave Behind program gives families an opportunity to keep their loved ones alive. Treatment is only possible for people who are living. The command center is also working with EMS authorities to look at the number of doses of naloxone provided to patients who overdose. For each of the last 7 weeks, that number is over 100 doses, with a high of 175 doses seen at the end of January and into the beginning of February. Another initiative set forth by Governor Wolf involved the Department of Corrections Body Scanner Pilot Program. The scanner has been a key part of a program designed to limit the introduction of contraband into the facility, reduce drug use, and better manage the re-entrant population, as well as increase staff and resident safety and well-being. Staff has performed more than 4,000 scans since January. So far, no overdoses have been observed in the building where the scanner is operational, since the body scanner has been in operation at the Wernersville Community Corrections Facility. To speed up and expand access to treatment, the Department of Health has developed a process to waive birth certificate application fees for those suffering from substance abuse disorders so they can get treatment. Over 30 applications have been submitted and processed, and these applications are available on the department's website. Last week, the Department of Drug and Alcohol Programs released guidelines for high-performing treatment facilities to seek a waiver for annual licensing requirements. So far, DDAP has approved requests to operate on a 2-year license for more than 60 providers. This gives providers more time with patients. While we are pleased with progress to date on these initial disaster declaration initiatives, we're working to add initiatives and tools to measure progress during these 90 days. One such example is the access to monthly Centers of Excellence data as provided by the Department of Human Services. Since October 2016, over 15,000 individuals have interacted with one of these Centers of Excellence in Pennsylvania. We are also working to connect with agencies and organizations across the state to ensure they understand that opioid use disorder is a disease and not a moral failing. Everyone deserves the opportunity to get into treatment and see the possibility that is recovery.